Hello everybody and welcome to this introduction to Carers Assessments. I'm Janine Wigmore and I'm a steering group member of the Parent Carer Forum Family Voice Calderdale. I'm mum to two gorgeous children, one of whom I'm caring for today. That's the boy in the photo. I hope you find this presentation helpful. I'm not a legal expert, but I've put together some very useful information from the charities Contact and Carers UK. So this is what we'll be covering today. We'll start with the big picture. What are carers assessments? Who are they for? And why do they matter? Then we'll look at the legal stuff. How do you get one? And what do they look at? And then we'll look at the difference they can make in terms of the help you may be able to get. And finally, an update on legal changes due to the pandemic and how this affects carers. So, what are carers assessments? First of all, don't be put off by the word assessment. It is not a test about how good you are at caring. It's to work out what can be done to make life easier for you. So, who are they for? Who actually is a carer? We'll explore legal definitions later, but it can be as broad as this. Basically, if you provide regular unpaid help to someone, you're a carer. But very often, people who carry out a caring role don't see themselves as a carer. There are good reasons for this. It may be because becoming a carer can be a gradual process. People may prefer to identify firstly as a husband, wife, sibling, parent, child or friend, rather than as a carer. They might overlook their own needs as a carer, or it could be because they don't live with the person they care for. Research by Carers UK found that the average time it takes for someone to acknowledge their role as a carer is 2 years. Often, it can take a crisis for someone to recognise they are a carer, and that's when it's really too late. Why do carers assessments matter? They matter because you matter. You may think that caring is just something you do, but that something is an awful lot. In 2015, Carers UK estimated that the value of the contribution made by unpaid carers was £132 billion per year. To put that into context, this is more than the NHS has been given to spend for the whole of this year. That's £130 billion. And that estimate was done 5 years ago, so the figure is likely to have increased. A Carers UK survey also found that 91% of carers said they had missed out on practical or financial support as a result of not identifying as a carer earlier on. Carers assessments matter because, put simply, we can't pour from an empty cup, and to carry on caring, we might need extra support. The NICE guideline on supporting adult carers notes the benefits of having a carers assessment. Our role and contribution is acknowledged, our needs can be addressed, and we can share valuable knowledge with services. It's important to recognise that as carers, we are actually part of a team, and we can work together with services to get the best support for the people we love. Okay, so now we're going to explore some of the legal stuff. Basically, how do you get a carers assessment and what do they look at? The first thing to understand are the different types of carers, legally speaking, and these are parent carers and non-parent carers, carers and young carers. So let's look at this in more detail. This table summarises the different definitions. First of all, a parent carer is someone over 18 with parental responsibility for a disabled child who's under 18. The key bit of law covering parent carers is the Children and Families Act, but also the Care Act as children head towards adulthood. Secondly, a non-parent carer is someone over 18 with responsibility for a child, but they are not the parent. So, for example, a grandparent. They are not covered by the Children and Families Act, but they are still covered by this regulation from 1995, the Carers Recognition and Services Act. Next, a carer is someone over 18 who regularly provides unpaid care for another person over 18, and not because they have a contract or for voluntary work. The key bit of law covering carers is the Care Act 2014. Finally, a young carer is someone under 18 who regularly provides care for either an adult or another child, again not under a contract or as a volunteer, and they are covered in the Children and Families Act, but again also in the Care Act as they approach adulthood. I just wanted to note who the law says is a disabled child. Often parent carers don't see themselves as carers because they don't recognise their child as being disabled in the legal sense. There are two definitions in use and they are both very broad. Firstly, this definition from the Equality Act, a physical or mental impairment that has a substantial and long-term effect on your ability to do daily activities. And this older definition, which includes some language we don't really use today, but still holds legally. Note that it refers to a mental disorder of any kind and other disabilities as may be prescribed. So these are very broad definitions and don't exclude neurodevelopmental conditions like autism or ADHD, either with or without a learning disability, or mental health conditions. And also note that a diagnosis is not required. For 3 out of the 4 groups of carers, the law says councils must do a carers assessment if it appears that a carer may have needs for support or they request an assessment. These are the same rights to an assessment as the person being cared for. So we now have equal rights for carers, which is very important. So you don't have to ask, an assessment could be offered to you. Councils have to take reasonable steps to identify carers in their area who might have needs for support. But different rules apply to non-parent carers of children. They only have a right to ask, so they're not offered an assessment based on the appearance of need, and they have to be providing regular and substantial care. A carer's assessment can be done individually or jointly. That is at the same time as the needs assessment of the person you care for. For parent carers, this could be at the same time as your child's social care assessment or EHC plan assessment, and your needs can be captured in these plans. Note that autistic children and adults who don't have a learning disability also have a right to a social care assessment. Even if a service says they don't meet their criteria, they still have a right to an assessment. But remember that while there may be benefits to having a joint assessment, you don't have to, and you can ask for an assessment at any time. You can do this by asking your GP to refer you to social services, contact your social service team directly, for example, the Disabled Children's Team or Gateway Service for Adults, and you can do that either by phone or in writing. Template letters are available, which we can share later. Or you can download a questionnaire and complete this yourself, and you can have support from the local authority to do this. So what do carers assessments look at? Again, don't be put off by the word assessment. So I repeat, it's not a test about how good you are at caring. It's to work out what can be done to make life easier for you. It will look at the impact of your caring role on your well-being, what help you might need, and whether it's appropriate for you to carry on caring in light of your needs and wishes. For carers of under 18s, They also look at the welfare of the disabled child and any other children you have parental responsibility for. For carers of over 18s, the local authority must not make any assumptions about what care you are willing and able to give. And all the assessments focus on preventing needs and early intervention. One of the key things an assessment looks at is your well-being, and this diagram shows the 9 areas that are considered. It will look at whether your caring role has an impact on at least one of these areas, and also the cumulative effect of impacts in a number of areas. And I'll read these out in case you can't see on the diagram. So the 9 areas of well-being are, first of all, social and economic well-being, personal dignity, physical, mental and emotional health, protection from abuse and neglect, domestic, family and personal relationships, personal control, an individual's contribution to society, the suitability of your living arrangements, and whether you can access work, education, training and recreation. When looking at your support needs, there must be regard as to whether you want to take part in education, training or recreation, and whether you work or want to work. And this is the same for all carers, no matter what age the person you care for. For parent carers, the regulations on short breaks also apply. These say the local authority has to look at whether you'd be able to carry on caring without breaks and if you could care more effectively with breaks. These include breaks to help meet the needs of other children and to do household tasks. In other words, local authorities shouldn't wait until families are in crisis before offering support. So again, the focus is on early intervention. Carers of children should also have an assessment as their child approaches adulthood, at the same time as their child's transition needs are addressed, and this is covered in the Care Act. So it must assess what the adult carer's support needs are likely to be after the child turns 18. It doesn't specify at what age the assessment should happen, but it could be from age 14, and it should be whenever the assessment would be of most benefit for the young person and the carer. And just a note about young carers, an assessment should look at what support they need, really to live an ordinary life, and also what needs they're likely to have on reaching adulthood. It must look at whether other family members rely on the young carer and whether the local authority should be providing services to the family as a whole. So that was parent carers and young carers, and now we move on to adult carers of over 18s. The Care Act introduced a national framework, so this means that wherever you live, the same criteria are applied. It's important to note that carers can be eligible for support whether or not the adult they care for qualifies for a support plan. And these 3 things are considered. Firstly, is the care necessary? In other words, could the person you're caring for be doing things for themselves? Is there an impact on your well-being? That's the 9 areas we looked at in the wheel diagram. And is your health, either physical or mental, at risk of getting worse? Or are you unable to achieve certain outcomes? And we'll look at these more closely. So it looks at 8 different outcomes, and you have to be unable to achieve at least one. And when we say unable, it's not just whether you can or can't do something, but whether you'd need support to do it, whether it would cause pain or distress, and whether it would put you or others at risk. So here is the list of outcomes, and it's whether you can care for a child, care for other people, maintain a habitable home, maintain or manage your own nutrition, develop and maintain relationships, engage in work, training, education or volunteering, and make use of community facilities such as shops, gyms or swimming pools, and engage in recreation. So you can see there's some overlap with the wellbeing areas. And again, to be eligible, you'd be unable to do at least one of these things because of your caring role. Now let's look at who's involved in doing an assessment. Well, first of all, it must involve you that's the individual being assessed, and it must be led by you, so person-led. If you're a parent, they could involve any of your children. If a young carer, they would include parents. The regulations also say any person the carer requests. This could be a friend or family member, but also an independent advocate. There are some rules on this. If it appears to the local authority that a carer would have a substantial difficulty in being involved in the assessment and there isn't anyone appropriate to support them, an independent advocate must be appointed to help them. And finally, social services. That's the person doing the assessment, and this must be someone who's appropriately trained. And if you have a particular need or condition, it must be someone with an understanding of this. Okay, so now we're going to move on to the outcome of the assessment. So that's what help you might get. For parent carers, this is likely to be short breaks. So not a weekend in Barcelona, sadly, but access to daytime or overnight care, either at home or elsewhere, educational or leisure activities for disabled children outside the home, or emergency care. Note that you can access some short breaks activities without an assessment. Have a look at the short break statement on your local offer website. Short breaks can be available either as a service or as a direct payment. For carers of over 18s, an assessment could result in a support plan for that carer and access to a personal budget. This could be a regular weekly payment or a one-off amount. In Calderdale, for example, weekly payments are about £20 and are to cover things like transport costs, promoting well-being, for example, gym membership or beauty treatments, or help in the home or garden. But remember that the assessment has to look at broader issues such as access to work and suitable housing. So if a carer's needs are over and above what a small personal budget would cover, these might be considered by a panel, for example, as they are in Calderdale. Carers of over 18s might also benefit from support provided to the person they care for. And this could include adaptations to make moving around the home easier, and for example, to reduce the need for lifting, delivered meals, laundry services, transport, additional care in the home, or replacement care to enable the carer to go out. And this would include daytime or overnight care. This support would be available either as a service or as a direct payment. Remember that when the needs of a person who's cared for are assessed, local authorities can't make assumptions about the level of care that you are willing and able to give. The Care Act says that local authorities can charge carers for services they provide, but they would have to do a financial assessment first to ensure that any charges don't have a negative impact on well-being. There's also a minimum income guarantee, so that earnings and some benefits are not included in the calculations. It's also important to note that carers can't be charged for support that's actually for the person they care for, and vice versa. So people who need care can't be charged for support that's actually for their carers. A quick note about support available for young carers. Local authorities usually have a young carers service that provides respite activities, one-to-one support sessions or group sessions, support in school such as young carers passports, or support for the whole family. Note that a young person who may be helping an adult or have a disabled brother or sister could access support from the age of 8. So if you are a parent carer with more than one child, this is something to consider. So what happens if you have an assessment and you don't agree with the outcome? Well, firstly, you should be given clear written reasons for the decision. This applies for all carers. If you don't agree with those reasons, you can then follow your local authority's complaints procedure. It would also be worth getting in touch with your local carers organisation to discuss your situation, and we'll have details about these at the end of the presentation. And finally, an update on changes due to the pandemic. For parent carers, there have been no changes to the social care assessments for disabled children and their carers this year, except for transition assessments. These come under changes to the Care Act, which I'll cover on the next slide. The government has also introduced guidance on the flexible use of direct payments during the pandemic. So if support you would usually access is not available at the moment, you are allowed to use payments on other things, providing they meet an assessed need. The Coronavirus Act has made changes to the Care Act. These are known as easements. It means that councils could now relax their duties, so changing from a duty to meet needs to a power to meet needs. But changes are only to be made where this is essential. Local authorities still have to take reasonable steps to meet needs, respond to requests for assessment, although except for transition assessments, and uphold people's human rights. They don't have to do detailed assessments or support plans, but they must still complete these when the easements eventually end. They could also temporarily suspend or cancel services, but they must use their best endeavours, which is a legal term, to maintain support and must inform you of any changes. Not all local authorities have chosen to use these easements, so if you are seeking an assessment, ask about any delays or if there's any new information to be aware of. In Calderdale, as an example, there are no face-to-face assessments at present, but support to complete a carer's assessment can be done over the phone. And you can still download a form from the council website or ask for one to be posted out to you. There are no new awards at present for activities that can't be accessed during lockdown, so things like gym membership or beauty treatments. Existing awards have been given flexible extensions. So if, for example, you were claiming for driving lessons for 4 months, this would be extended for an extra year. Or this could be longer if the person you care for is shielding. So to sum up, carers assessments are important because you are important. And to access one can be as easy as making a phone call or downloading a questionnaire from a website. If you need any help with a carers assessment, these organisations have lots of information and can give practical support. So starting with the local ones, the carers organisation is Calderdale Carers, and in Kirklees it's Carers Count. Carers Count is a project of Cloverleaf advocacy, and that service is also available in Calderdale. If the person you care for is under 25, then your Parent Carer Forum should be able to help. In Calderdale, there's Family Voice Calderdale, which is a project of Unique Ways, the charity, and in Kirklees this is Pecan. For young carers, Calderdale has a young carers service, and in Kirklees this is Bernardo's Young Carers. Nationally, these organisations have lots of information and helplines that you can ring. So that's Carers UK, the Carers Trust, Contact, and the Children's Society. Oh, and Carers Direct. There are a series of fact sheets about the Care Act on the gov.uk website, and NICE have new guidance on support for adult carers, which is on the NICE website. Thank you everybody for listening. I hope you feel that you now know more about your rights as a carer, and if you haven't already, that you would consider asking for a carer's assessment.